Hello, everybody. Tyler Pettit here with Medicare in the Mitten. Today's video, we're going to talk about Medicare Part B. So in other videos, we've talked about the other pieces of Medicare, specifically Medicare Part A, your hospital insurance. Today, we're going to talk about Medicare Part B. Medicare Part B is your medical insurance. So let's break it down. So Medicare Part B, what is it? What does it mean? Part B is your medical insurance. So when you order that Medicare card, for those of you that have it, you've seen it there on that red, white, and blue Medicare card. It says Part B medical. For those of you that don't know, maybe you haven't signed up yet, you're going to sign up yet in the coming years. Medicare Part B is your medical insurance. What does that mean? Well, as your medical insurance, it covers everything essentially considered outpatient. Right? We know that Medicare Part A, if you watched the other video, you know that it was a hospital admission. It requires an inpatient hospitalization. Medicare Part B is going to be everything considered outpatient. It could be an outpatient procedure. It could be a visit to your primary care physician. It could be a visit to your cardiologist, your physical therapist. Everything considered outpatient is going to qualify under Medicare Part B. How does it function? So, Medicare Part A, it has a deductible. That deductible is a per benefit period. Medicare Part B, your medical, has a deductible as well. That deductible, though, functions in a calendar year, right? Different than the Part A deductible. The Part B deductible, your medical deductible, it functions similarly to the deductibles that you're used to in health insurance, meaning it lasts for the calendar year. This video is being filmed in 2026. The Part B deductible is $283. Okay? Yes, 283 American dollars, right? That is the deductible for Medicare Part B. Once you have reached that, anything above it, you enter a coinsurance phase with Medicare Part B. In that coinsurance phase, you, as the beneficiary, are going to pay 20% of all medical costs outpatient, right? Outpatient medical costs. 20% of all costs. Medicare Part B is going to pay the remaining 80%. The difference between this and the health insurance that you're used to is those plans had a max out of pocket. They had a cap, a limit that you could hit. On original Medicare Part B, there is no limit. There is no cap to that. So if you get a $100,000 medical bill for an outpatient procedure, Medicare Part B is going to cover $80,000 of it. You are going to be responsible for $20,000. And then 20% of the next bill. And then 20% of the next bill in a calendar year. Okay, there's no cap, there's no limit on that in its original form. Obviously, we'll talk about things like a Medigap plan, our Medicare Advantage plan, and how those kind of interact. But in its original form, that's how Part B functions. Okay, unlike Medicare Part A, Medicare Part B comes with a monthly premium. The monthly premium in 2026 at its standard rate is $202.90. Last year, in 2025, the standard Part B premium was $185. 2026, the standard Part B premium is $202.90. Now, why do I say standard? Because there is something known as the income-related monthly adjusted amount. You'll hear me refer to that as IRMA. Okay, I'm going to have an entire video linked here that's going to talk about IRMA, what it means, who it impacts. Again, standard premium in 2026 is $202.90. That is going to be a monthly premium for Medicare Part B. If you go on Medicare Part B, that $202.90 will be deducted from Social Security automatically if you're drawing it. So if you're drawing Social Security, that Medicare Part B premium is going to be automatically withdrawn. Okay, it's going to be automatically deducted. You don't have to think about it. If you delay your Social Security payment to 2 years down the road, 4 years down the road, if you're not drawing Social Security, you will be billed on a quarterly basis from Medicare Part B. When I say that, it's Social Security for Medicare Part B. But you get what I'm saying. That $202.90 per month is going to be billed quarterly, right? So you're going to be billed 3 months at a time. It's going to come in the mail. You pay it from there. So one thing I like to note, so I talked about the different ways that Medicare Part B covers things, what it covers. One thing that I like to make clear for people is it covers a small amount of drugs. So we'll talk about Part D prescription drug plans in another video and how Part D works. D is for drugs. That one's easy for everybody. Certain drugs are covered under Medicare Part B. What drugs are covered? Those that are administered by a medical professional at a medical facility that they order. So an infusion, an injection. So if you go to the pharmacy, you pick up the prescription, you inject it yourself. That's Medicare Part D. We'll talk about that in a different video. If you go to the doctor's office for a monthly, a weekly, a quarterly injection, that medical professional, doctor, PA, NP, whoever that may be, they inject it for you. They administer the drug for you at their facility. Medicare Part B will cover that. Okay, that's something I see that screws people up from time to time, is understanding where the coverage lays. I'll make a short video that addresses this, but I like to include that when I talk about Medicare Part B because I think it's important. Okay, so again, Medicare Part B is your outpatient, right? That's where the coverage lays. Important points. $202.90 a month is the standard rate in 2026. That's a standard Part B premium. Okay, automatically taken out of Social Security if you're taking it. Otherwise, it's billed quarterly. It has a calendar year deductible, $283 in 2026. Finally, once you meet that deductible, 20% of all outpatient costs fall to you. Medicare Part B pays the other 80%. Okay, that is Medicare Part B. If you have questions about that, if you need more information, my contact information is below. Call me, email me. Let's go grab coffee. Let's have a phone conversation. Let's talk more about it. Okay, but please, if you would, like, subscribe, comment on the videos if this helped you in any way. You have additional questions, but please, if you would, do those things. More videos to come. Thanks for following.